Hi, I'm Anne and I'm one of the occupational therapists from the Community Respiratory team. If you're living with COPD, you may be finding managing everyday tasks increasingly difficult due to breathlessness and fatigue. Breathlessness commonly causes people to experience anxiety, which can in turn make you feel more short of breath and heighten the perception of your symptoms. Symptoms of anxiety can include an increased heart rate, increased shortness of breath, a churning stomach, or sometimes a sense of urgency to use the toilet. It can cause physical tension, particularly in the neck and shoulder area, and this can often lead to holding yourself in a tense position, restricting movement in your chest and making it feel more difficult to breathe efficiently. Sometimes these symptoms are coupled with an intense sense of fear that something bad is going to happen. You may notice thoughts such as, I can't do this, I can't breathe, I'm going to collapse, or even, I'm going to die. This can be very distressing, and sometimes these thoughts and symptoms can arise before you have even begun to carry out a task. Anxiety often gives us a sense of urgency, making us want to hurry through activities in order to get them over and done with. Rushing a task increases breathlessness, which feels unpleasant, and in turn increases anxiety. This then tends to make you want to avoid this activity in future, as it can be so uncomfortable. Avoiding activity may seem useful in the short term. However, in the long term, it can be debilitating, and we may end up stopping doing the things that we used to enjoy and that are important to us. It's therefore important to find ways of coping with breathlessness, fatigue, and anxiety to enable us to live our lives in the best way we can, maintaining independence with activities that are meaningful to us. Introducing relaxation can be very helpful. We encourage people to practice very short, specific relaxation exercises, or perhaps participating in activities that help us feel relaxed, such as crosswords, puzzles, or painting. Relaxation exercises involve carrying out very simple techniques to release tension in your body, particularly around your shoulders, with a focus on slowing down your breathing. Slower breaths work to calm down your nervous system and creating an overall sense of relaxation. At the end of this video, I've included some links to useful resources, including relaxation techniques that you can try out yourself. Often, when we feel limited by our physical health, it's the things we enjoy most that we stop doing first. So it's worth having a think if there are things that you have done in the past that help you to relax, or maybe try something new. Breathlessness and anxiety go hand in hand. Often the best way of managing anxiety attacks is to keep your breathing under control during activity. And one of the best ways to do this is through energy conservation. So this is about completing the task in hand, using the least amount of energy, so that you have more energy available for other things. Energy conservation comprises of 3 main principles: pace, plan, and prioritise. Pacing is a really important strategy to use. It's about slowing everything down and taking regular rest breaks, allowing your lungs to keep up with you. We want to avoid becoming very out of breath, as this makes any experience unpleasant, and it'll take a much longer time to recover. So, for example, when you're getting dressed, you might want to put on one item of clothing at a time and take as long as you need to recover your breathing in between times, rather than trying to rush through the whole task. You may choose to start with dressing your lower half, since that takes the most amount of energy. You can then take a rest break and go back later to dress the upper half. If getting to the toilet is difficult for you, you may want to simply sit up in the edge of your chair at first, take a pause, use your breathing control exercises until you feel your breath is comfortable and controlled. Once you're up and walking, you may need to stop and rest somewhere in between, for example, your living room and the bathroom. Often a small chair or perching stool in the hallway can be beneficial to allow this rest break. Plan your day and week accordingly, ensuring that you're fitting in a mixture of things that need done with the things that you want to do. It's important to plan ahead for tasks. So if showering is difficult, you may plan to have everything laid out and ready the night before to minimise the amount of work required in the morning. You may even prefer to have a shower at night time to conserve your energy for the following morning. Prioritise what needs done and what can wait. It may be that you have essential tasks that need completed which will leave you little energy for other things. But remember that it's important to prioritise things that are meaningful and bring you a sense of satisfaction. Don't be afraid to ask for help. Often, friends and family are more than happy to lend a helping hand. Consider if there is someone who can help you with basic household tasks to enable you to save your energy for something more enjoyable, such as meeting a friend for coffee or spending time with grandchildren. These are just some basic tips to give you an idea of strategies that can be used to manage breathlessness and anxiety in your everyday life. I've attached a link for further practical tips on managing tasks such as dressing, meal preparation and bathing, as well as some useful resources to help you understand and manage symptoms of anxiety. If you feel you would benefit from an assessment or further advice from an occupational therapist, get in touch with your GP or local social work department who may be able to arrange this for you.